Hello, and welcome to Boston Seniors Count. I'm your host, Fran Janine. You know, on our show, we believe that you are the foundation on which Boston was built. So our goal is to connect you with all the resources, the benefits, the information, and to enhance your life as we go along. We thank you so much for joining us. We're on a lot on BNN. You know that we've been here over 20 years, and the show is played a lot. So we hope you'll tell your friends also to look at the schedule and see if they can catch it. Today, though, I'm doing a little different show in the sense that we're talking about a program a lot of people don't know about. Some people have used it and some people haven't. But our guests today are Paula and Deidre. I want to welcome both of you to the show. Thank you. I know you both have busy schedules, right?
Thanks, Fran.
You're both
Thank you,
nurses.
I'm a social worker.
A social worker, and you're the nurse, right? Well, what I'm going to do is I'm going to start with you, if you don't mind, Deidre. Okay? I want you to tell us your name, where you came from. You're the nurse, right?
Right.
And how you got into the company. And the company that we're talking about, it all started at Beth Israel Hospital, where I learned about this, palliative care, which we'll do another show about that. But of the palliative care, we learned that we have a program called
Hospice?
Hospice.
Right.
In hospice, a lot of people say, hospice. I've heard of that. They come to your house. They call you. Deidre, tell us first about yourself, and then we're going to start with the program.
Well, my name is Deirdre O'Hare, and I'm one of the nurses at Good Shepherd Community Care Hospice. I've been with the hospice for 6 years, Fran.
Wow.
And I came from a whole different background. I was doing clinical device training. And
Clinical device.
Yeah. And
another whole world.
a whole world different. And then before that, I worked for 19 years, though, at the Beth Israel in Boston.
Right.
Did many different types of nursing there. But what brought me to hospice was a couple of family members that had been in hospice, and my experience with those hospices, one on the West Coast, that just impressed me terrifically. And the opportunity came up, and I decided to join a hospice, doing something very different.
And from that, Beth Israel Hospital, and the program is the Good Shepherd.
It's Good Shepherd Community Care Hospice.
Right.
Yeah.
When I heard it first, I said, is that a dog program? Right. The good, well,
That's
some
what we
senior would
talked
say a
about.
Good Shepherd, you know, but no,
That's what we said.
it's a human being program.
It is for human beings,
Good.
yes.
Okay. Paula, tell us a little bit about yourself, and then we'll
Sure.
start talking about the program.
Sure. So my name's Paula Angel, and I'm
Okay.
a social worker at Good Shepherd.
Right.
And I've been doing this about 4 years. I've been a social worker for about 10 years. And before that was in sales and marketing, and stayed home for a while raising my kids. And
Good.
so it's been a great change in my life to find social work, and then especially hospice.
Hospice.
There's a lot of meaning at the end of life, and it seems to be something that I'm drawn to.
Good.
And
it's working.
I love meeting patients like you, and we're very happy to be able to be here. Thank you for
Right.
having us.
So how long now you've been with the Good Shepherd?
4 years.
4 years you've been with her.
Right.
So you do social work, she does nursing. So your public relations basically every minute. Basically, when you think about it, that's what you're doing.
Yeah, we work as a team. It's a
Yeah,
really
yeah.
important
Which
part
is-
of hospice.
I would think so.
That
Good.
we have lots of different disciplines to draw from. We also
Right.
have spiritual care for people who want it. We
Right.
have volunteers who do all kinds of things, from pet therapy to massages, Reiki, art therapy, music.
Yeah, see, people don't know this. So let's talk about the hospice. First of all, that's a program, right?
Yes.
It's a
It's a
benefit from
medical
insurance.
program.
Yes.
You can get it free from insurance,
That's right.
Yes.
That's
right? Which is part of what life is right now,
Yes.
Right.
with all types of insurance.
Like
Yes.
Medicare, Blue Cross, whatever insurance you hold, every insurance has a hospice benefit.
And that's important.
That's how we get paid.
Very important that people know that.
It doesn't cost them anything to have hospice.
Hospice, okay.
Exactly
And
right.
hospice is sent by who, though?
So,
Two physicians need to approve a patient's qualifications for hospice, Fran.
Okay,
And the patient needs to have an estimated, I use that word loosely, estimated 6 months of life remaining. Many of our patients go on beyond that estimation, as you can probably tell, but it is designed for those folks that are close to the end of their life and have chosen to remain at home.
Okay.
In other words, they've been in and out of the hospital perhaps many times, and they've said, this is it. I want to stay at home with my family and my friends and receive my care at home. They can always make the choice to go back to the hospital if they want to, but no one's going to force them to do that. So in other words, we can go in and do the care at home.
Right.
And part of that is also deciding not to go on with any invasive type of treatments.
Right, right.
You know,
Curative,
if there's palliative, I use that word before, comfort care measures that can help someone be more comfortable, then we work with the doctors and the family to
Okay.
determine what those are sometimes. But oftentimes it's really just receiving the care at home. And a lot of people relax into that. They know they don't have to be running back and forth to the hospital anymore
Which is
and
good.
spending a lot of energy doing that, and it can be a real comfort to people to just be home and
So
know
the
they're gonna be
patient
comfortable.
basically gets to talk with you, and they make the decision
Right,
to learn what hospice will give them,
Right.
exactly.
which is very unusual. That's very good, that they can sit and talk and say, okay, I need this, I need this.
It's
and-
very individual, yeah, each
Yeah.
plan of care.
And then you come back and you say, okay. You're not saying no, 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 no.
We
Exactly.
try to say yes as much
Yes,
as possible.
But no, that's, when you
Yeah.
think about that,
Yeah.
that's
Yeah.
the whole key. That must make a patient feel 100% better.
Well, right, one of the big things is for the patient to feel in control.
Right.
And of their own plan.
Right, now hospice has been around a long time, but a lot of people have no idea about it, or they heard it different.
Well, we started in 1978, Fran. We were-
78?
We were actually the first hospice in Massachusetts.
Wow, see?
Very small. A group of 3 individuals got together in Newton and decided there was a need for a
Right.
hospice-based program. Very small, very individual, very low-key. And it has just grown as the need has
Right.
grown.
And
I
that's
think-
been marvelous,
Yeah,
almost 40 years,
Yeah, it's
Right.
which is
amazing.
good.
Yeah.
And from that, you keep growing and growing and growing, because more patients learn about you.
I think so, yeah.
More people
yeah,
can learn about
yeah,
you.
Yeah, there's always an opportunity for more education about hospice because it's a need-to-know type of program. People don't seek
Right.
it out ahead of time very often,
Right.
but they'll want to know the information when they need it.
When they
it's very
actually
much a
need it.
need to know. Yeah.
And you sit and do it with them.
Absolutely. Often what we'd like to do is have Paula and myself, the social worker and myself, come in together. So the team comes in together
Right.
to do the initial information visit. And then the patient may be ready to sign on, start services that day, or they may just want to think about it.
Right.
It's always okay. You know,
See, and that's what's good to know.
Yeah. you
Because
don't
as
push
senior is
people.
sitting home
Yeah.
now, I'm thinking, I should have this.
Yeah.
You know, I
Right.
need the extra care. Do I want to give in? Seriously, that's about what it comes down
Some
to.
people feel like it is sort of giving in, but we look at it as just being able to do what you want to do with a little bit of extra support.
Right.
Okay.
You know, we layer on top of your current physician, who's your primary care physician.
Right.
They still write all your scripts and are very involved in your care.
And you
can-
work with it.
And we work with
Yes, we
them.
do,
We're
yeah.
just a kind of eyes and ears of the person's
And the nice
doctor.
part of it is that in reading a little bit about hospice and finding out, they get a lot of different things from hospice.
Yes, yes.
I mean, the wheelchair.
The
Yeah.
wheelchair I just
Yeah.
got for you, exactly.
Right, yeah, which
I
is,
pick up the phone and I order it for you because you need it.
right. It's unbelievable that they don't have to fight or call 100 people to get the stuff. So if you need this medicine, it comes,
Right.
Exactly.
Right.
which is unbelievable when you think about what seniors have to go through
Right.
to get some stuff. But then now you come often to code the people and tell what's good and what's bad, what's going on, what's not going on.
What do you, I'm not sure. I
Well, in the
see-
sense
terms
that
of
you as a
visits?
nurse, yeah, as a famous visit as a nurse, you come and you, whatever the word is, that check them all, see how it's going, right?
Absolutely. What we do is we put a plan of care together with
Right.
with our patient, Fran, and decide how many visits are needed, how many visits are going to be appropriate per week. Does someone need one visit from me a week, or
Good.
2 or 3? Same with Paula. We need 1 visit per month, 2 visits per month, 3.
Right.
We design that program of care with you and your family,
Right.
and we can change it as we go. We tailor it as we go.
And you see what they need and what they don't
Right.
need.
Absolutely.
Because often as things change, we have to change
We
how
change.
often we visit people.
Right, which is good.
Sometimes you see people a lot in the beginning, and then things kind of even off, and then we
Right.
don't see them as much. And then when things maybe decline
Go
or
down.
start to change,
Start to change.
then we would see them more
See,
often.
that's the
So
sad part, that people, you know, you start off and you feel okay, and then you slowly go down. A lot of seniors are experiencing that.
Yeah.
They're going through all different types.
A lot of
And then the
losses, yeah.
family, it's like, oh my God, what we're going through.
Very hard for their families.
Very hard for the family. And a lot of the seniors want to stay home. They don't want to go to the nursing home.
Exactly.
Right,
Exactly.
I mean, they keep saying, I'd rather be in my own bed.
One thing I should say, Fran, though,
Yeah.
is that we go to where our patients are. So in other words,
Okay.
if our patient was in a nursing home already and the decision was made to bring in hospice care, we can actually do visits in, if we're contracted with a nursing
the
home.
nursing home,
We
right.
can go there. We can do special levels of care in some contracted hospitals
I
if
see.
that's. And so there are other ways to go see patients where they are and
Even-
Which
provide.
makes a big, fantastic change, doesn't it?
It does.
With everything. So basically then, if somebody is sitting listening at home now and they're thinking, oh, hospice, maybe I should find out more about it, where would they go?
They can call us.
They can call you?
Anytime. We have a 24/7 nurse on call.
Okay.
That's part of the program for our patients, especially who have questions in the middle of the night. They wake up with a
Oh,
pain
right,
or
yeah.
nausea or whatever.
That's fantastic.
They can call anytime, and so it helps to keep things calm and to
Right.
give them the help when they need it.
But
not
this
have
if
to-
somebody now is at home sitting and saying, I think I'd like to find out about hospice. So do I have to call this, and this, 7 different numbers to get to hospice? So what would you suggest they do?
There's one number to call.
One number. And is
you
it
want me
under
to-
hospice or is it under Good Shepherd?
It's under Good Shepherd.
under Good
It's
Shepherd.
Good Shepherd Community Care. If they Googled hospice, they would probably come up with a lot. There are many hospices
Right.
in Massachusetts.
That's the thing. But we're looking right now at the Good Shepherd Hospice.
That's who we
Okay.
happen to work for, right?
That's what you're working for, but that's coming out of the Beth Israel Hospital. Well, it was
Actually,
one of
No, well,
the palliative.
Actually, we have a relationship with several hospitals,
Okay,
Fran.
good. See,
But
this
we
is
are-
good to know.
But we are a standalone nonprofit
Right,
hospice
okay.
in Massachusetts, yeah.
Okay, which
yeah.
is good to know.
Yeah, yeah.
So, in
Yeah.
other words, somebody's saying, I think it's time I need this, or I need that.
oftentimes they would talk to their doctor
doctor, yeah.
first.
That's what I wanted to
Because
get at, the
um,
doctor first.
There is the eligibility that Deirdre
Right,
talked about
right.
before. So their doctor would have to feel that they are probably within 6 months or so.
Right,
And if that's true, then the doctor could make the referral to hospice, or
Right.
they could call themselves.
right.
Anyone can make a referral to hospice. It
Right.
doesn't have to be the hospital
Right.
or a doctor even.
So in other words, there are so many ways of getting the care.
Absolutely.
Don't stay home and not call upon it. It's there to help you. I mean, there's so much.
Right.
And that's what we want. We want to be able to draw upon what's out there for seniors. And
Exactly.
it doesn't matter if you're in the wheelchair, or if you're in the bed, or if you're still walking around.
Exactly. Exactly.
You're eligible.
Absolutely.
If your particular illness, the progression of it, what doctors know, what we know, which we're not very good at predicting
No,
these
I
things
know,
at
yeah.
all. But best guess at that moment.
Right,
If
okay.
if it is, then right, then you could qualify.
good.
If you don't, then we keep in touch too. We can
do
follow
it.
up.
Yeah.
Now, a hospice person come into the house. Okay, I have a friend who is going through it, all right, and a hospice was recommended. The woman came, he was introduced to them, a nurse was there, introduced her. It was really nice to get to know what the woman wants to do. And she just said, I do everything. And my friend said, you do what? She said, I do everything. I will wash the dishes, I will vacuum, I will change the bed. Whatever you have to do, I will make you lunch, or breakfast, whatever time I'm coming. I wash you. I'll put your laundry down in the machine. Whatever has to be done, that's what I'm there
That's
for.
an important.
And I really laughed because my friend said, will you cut my apple? Yes, she would cut my apple, right?
Absolutely,
But to a
absolutely.
senior, this is a senior, cutting an apple with a knife is hard.
It's a big thing.
So she said, will you cut my apple? Yes, she would get that for her. So at hospice, when you sense we say they'll do everything, they will do a lot, seriously.
We do as much as we can, Fran, and if we
Right.
can't, we find the resources that are more appropriate.
Exactly, that's what I wanted the seniors
Yeah,
to know, that
yeah,
it's out there.
yeah, yeah,
Right, now,
yeah.
you're not driving them anyplace. Senior, you can't go to the bank with a hospice person. You can't go buy a lottery ticket type of thing, which seniors would love to do. No, seriously, sometimes they'll say, oh, you got to take me here, you got to take me there.
Well, the home health aides can't do that.
Right,
Right.
The
right,
services
right.
you were just talking about were
Or home health aid.
Or home health aid.
Yeah, you were describing a home health aid, you know, making
Right.
the bed, giving the bath.
Right.
But volunteers can do some driving as long as it's cleared
Yeah.
and it's checked out.
Right,
safe.
everything
Yeah.
has to be,
Yeah.
type
Yeah.
of thing.
Yeah.
But on the whole,
Yeah.
they don't do the majority of them don't do
So
it.
if you had a volunteer, they could potentially take you out to
Potentially.
a favorite activity or something. Again, everything's individualized, so we
Right.
try to, like you said, say yes as often as possible.
As possible.
Yeah.
Okay, now I just, one question on hospice. They don't get paid? Does a hospice person get paid? They must get paid because they're working.
Like us, you're saying?
No, I'm talking about the hospice people, they actually come to the house.
We are paid, we're on salary,
yeah.
Fran.
Well, you would
so
be,
We're
yeah.
on salary, so the folks, anyone who comes into the house is not paying any money.
Right, okay.
No,
You don't-
our
you don't
patients
have to
don't
pay.
pay.
You don't
our
pay a
patients-
cent.
Services.
Yeah, there's no money exchanged when a hospice worker comes in.
Okay, so
So,
the
yeah.
hospice itself person gets a little amount of money
Well,
from,
so yeah, most of our people who come in, who would visit
Right.
a patient would get paid, but then we have volunteers and
Right.
a lot of them are not paid.
that's what I'm getting
They're
at. So there's two
volunteers,
different
right. Yeah,
type
there's-
of
right.
programs
Right.
with it. But they all want to help.
But all the same goal, right, is to
right,
keep the
right.
patient
Help is to keep the
comfortable
patient,
and
get it where they can see things, do things.
to be as active as possible to whatever they want to do to try
Right.
to help them meet their goals.
Which is unbelievable. It's almost like having a special friend to hold your hand.
It's
Many times, Fran, relationships do develop between our patients and
I would
our,
think
and our
so.
care, in our care team.
Yeah,
It's serendipity. We don't expect it. When it happens, it's wonderful. There are some great levels of support that can happen if a senior needs that help.
right, type of
And
thing.
one thing I wanted to say, make clear that you don't have to be homebound to receive hospice services.
You can still go out and do
You can
things,
That's
go
a
out and do
difference.
whatever you want.
which is nice.
Yeah.
Yeah.
Whereas some you have to be homebound.
misconception, too,
Yeah. Yeah.
Type of thing. Well, to the seniors, a lot of you know that I've been going through terminal cancer. I've been sick. And I have to tell you that I now have them. I have hospice. It has been an extra blessing. I thank St. Anthony every day that they came to my door because it's made a difference. And I know a lot of seniors are going through different illnesses. And they're talking about that little extra care that they need that helps the kids, so that they're free. And hospice is becoming a blessing. It's called the Good Shepherd, which was it's from. But I think that they've got to find another word because it's becoming a fantastic blessing for many people. And you know what they're finding out? The men like it, which is very unusual because men don't like other people coming in the house.
sometimes, yeah.
Sometimes
You have to
they
be
don't.
Very careful.
Right,
yeah,
they really
matching
don't.
People.
Matching
it's a
people
very
up.
intimate thing.
And you do
Yeah.
that. You can match a
You
man
have-
with a man.
Yeah, exactly.
We
A woman
do,
with a
whatever-
woman.
Yes, we do.
Preferences people have,
Yep.
we try to meet
Yep.
that. Yeah.
Right, so now that
Exactly.
alone
Yeah.
Exactly.
makes a big difference to them.
Yep.
In the long run, when you think about it, it's like, wait a minute. This is unbelievable.
Because it's all about comfort.
Right.
So what makes you comfortable, especially when you're in your home. We're guests in your home.
Right.
And so you get to lead the way and tell us what you need.
But what I liked about his hospice is that you take, how shall I put it? You take the time to examine everything first. And then you offer stuff, which makes a real big difference.
Yeah.
Which then the seniors will think, or not just seniors, but anybody, think, okay, this is good for me, this is good for me, this is good for me.
And it's very individual. Some people like a lot of services, and some people just want the very minimum,
Minimum.
to be safe and
Right.
to be able to be
Right.
with themselves. And
Right.
so it's really variable.
Very powerful. Now, as a nurse, you know a lot of the medicine they get. Patients get, well, you can read it, what's in front of you. But you have to know a lot of what it's there. And you maybe can see the difference of seniors as they take the medicine.
There are a lot of issues with medicine, Fran, as you know. Many seniors take
Right.
a lot of medicine. So yes, one of the first things I do as a nurse is take a look at that long list, and with the patient's physician or nurse practitioner, decide which medicines need to stay on board and which medicines don't.
Which makes a big difference,
Yeah.
that's for sure.
And we can reimburse for the cost of medications that are directly related to a patient's illness. In other words,
Interesting.
if it's a cancer and those medicines are directly related to the cancer,
Right.
then we can make sure that
And
we
that
cover
can help a
those.
lot,
Yeah.
too, when
In
you
other
think
words,
about
those
it.
medicines are
Yeah.
part of the plan.
Yeah,
so
they
you
become-
wouldn't pay
Yeah.
for those
Yeah.
medicines.
Some
now.
of the
That can be a
medicine-
savings
Yeah.
for
Yeah.
people.
I know some of the medicine is unbelievable.
And they get delivered to your home,
Yeah.
so nobody has to
Yeah.
run out.
Run out and get them,
get
which is
them,
even
so-
fantastic
Right.
type of
Right.
thing.
Right.
So basically, this program's a blessing for people who are just learning about it. I mean, it's been around, yes, and you hear good and you hear bad about every type of program.
Right.
But in the long run, what this is, how shall I put it? This is an offering that people haven't taken up on.
There are many people eligible who don't
Right.
either know about it or choose not to, but yeah, we're thinking that people are starting to talk about it more. Doctors are starting to introduce it to their patients
Okay.
earlier in the cycle, because like you said, I think a lot of people think of it as a, oh my gosh, I only have a week or two left to
Right,
live.
yeah.
And that's totally not what it is. It's,
So
it's
it-
meant to be much longer than that.
And it can help you.
And we even discharge people sometimes too. If you come in with a crisis and then you get better,
Right.
and then you no longer meet the criteria, we every 3 or 2 months, depending on where you are in the cycle,
Yeah.
we reevaluate you. And if you're no longer eligible, then we discharge you, which is a wonderful thing. Because,
Unbelievable when you think about it.
So yeah, there's
Wow.
it's not a permanent thing necessarily.
You do the whole type of thing. Unbelievable. I can't believe we're out of time. I want to thank Deidre very much, and I want to thank Paula. The program that we just talked about is for you. It's for seniors, it's for other people also, but it's a program that's for caring. When you think about it, it's almost like a God-given gift, really coming to help you towards the end. Right? It's to help your family. It's to help a lot of things, really, when you think about it in the long run. I appreciate what you do in life, the two of you.
Thank you.
God bless you, really, continuing the work. Thank you for helping us. And if people call you, the Good Shepherd is what you're calling to learn about hospice, or you can ask your doctor. They, in turn, have every telephone number and every place where to find hospice. And hospice is there for you. Don't think of it as, oh, well, it only helped my friend. No, hospice will help you. Thank you, Deidre. Thank you, Paula.
Thanks, Randy.
Good luck helping all the people out there.
Thanks.
Thank the program. Whoever is in charge, tell them God bless,
Will do.
because we got to keep going, right?
Exactly.
We want to thank you for watching Seniors Count. It's how shall we say? It's brought to you by Mayor Marty J. Walsh and our Commissioner Emily Shea. To contact us, please call 617-635-4366. Or remember, you can always call the Mayor's 24-hour hotline, and that one's at 637-635-4500. You also have an email you can get at the elderly at boston.gov. Or you can find us on Facebook. There's so many places. Pick up the phone and call Elderly Commission. Talk to a friend, Elderly Commission. The Elderly Commission has been around many years, started way back when Curly. It goes way back to the 50s and 60s type of thing. But the thing is that, how shall I put it? It just grew and grew and grew and grew and grew, and it's there for you. So today's program, Hospice, which is coming out of the Good Shepherd, these ladies are there to care for you. And that's what we want to make sure you get that care. So don't forget, you can find us, again, on Facebook, or you can call and ask for the Elderly Commission at City Hall. Remember, it's all live voices that you get from 8 o'clock in the morning till 5 o'clock at night from the Elderly Commission. Then afterwards, it will go to the Mayor's hotline, and you'll get a call back. And remember that there is an advocate for every neighborhood in your city, in the city of Boston, that's there to help you. Just like they're available, so are theirs. So we want to tell you to take care, and we hope we see you next time. I'm Fran. Our guest was Deidre and Paula. And I want to thank all the people who have been saying a special prayer for me. A lot of you know that I've been ill. I thank you 1,000 times. But we also thank Boston Neighborhood Network for bringing the shows on so that seniors are learning. Thank you.
And I think to myself, what a wonderful world. Yes, I think to myself,